Welcome everyone. I'm excited to kick off episode 27 today. This is our very first slide, so I want to warmly welcome you all and thank you for being here. Today, we'll be exploring an engaging topic that I think you'll find both insightful and inspiring. We'll be covering the key points and ideas that will help you understand the subject better. So, without further ado, let's dive into what we have prepared for you today. So, in this scenario, we're looking at a nurse preparing to take vital signs in a client who is alert, but admitted with dehydration caused by vomiting and diarrhea. The key question here is, what is the best method to assess the client's temperature? We have several options: oral, axillary, radial, and heat-sensitive tape. When choosing the most accurate method, we need to consider the client's condition. Since the client is dehydrated and has been vomiting and having diarrhea, their oral cavity might be compromised or difficult to access properly. The oral method is common, but in this case, it might not give the most reliable reading if the client has been unable to keep fluids down or has a compromised temperature regulation. The axillary method, which measures temperature under the arm, is often less accurate and can be influenced by external factors like room temperature. The radial method, which involves feeling the pulse at the wrist, isn't used for measuring temperature directly, so that's not relevant here. And then we have heat-sensitive tape, which provides a quick visual indication but isn't the most precise. Given all this, the most appropriate method for assessing temperature in this specific case would be the oral route, but only if the client's condition allows. Otherwise, in dehydrated or compromised patients, rectal temperature measurement might be more accurate, though it's not listed here. So, understanding the context and the client's condition helps us determine the best approach to obtain an accurate vital sign reading. Let's take a closer look at the axillary region. This area is quite important because it contains several key structures, including lymph nodes, blood vessels, and nerves. When we're assessing or treating this area, understanding its anatomy helps us locate and manage potential issues effectively. The axillary lymph nodes, in particular, play a critical role in immune response and are often examined for signs of infection or metastasis in cancer cases. Remember, the axilla is a complex space, so a thorough knowledge of its anatomy is essential for accurate diagnosis and successful intervention. This region exemplifies how interconnected our body's systems are, reinforcing the importance of detailed anatomical understanding in clinical practice. Since the client is experiencing vomiting and diarrhea, the oral route for taking temperature is not suitable at this time. This is because these symptoms can interfere with accurate readings and may pose a risk of contamination or discomfort. In such cases, an alternative method is necessary. Axillary temperature measurement is a safe, non-invasive option that works well, especially for an alert client. It's a reliable way to monitor temperature when oral measurements aren't feasible. The key point here is that when oral routes can't be used, axillary temperature measurement provides a safe and appropriate alternative, helping us ensure accurate assessments without causing additional discomfort or risk to the client. This approach aligns with our overall goal of providing safe, effective, and patient-centered care. Now, let's talk about some options that are not recommended for measuring body temperature and why. First, oral temperature measurement is not suitable if the patient is vomiting. In such cases, it can give an inaccurate reading and might even be unsafe. Moving on, the radial pulse measurement, while useful for checking heart rate, is not appropriate for measuring temperature. It's simply not designed for that purpose. Next, heat-sensitive tape might seem like a quick fix, but it's actually unreliable for core body temperature measurement. It doesn't reflect the internal temperature accurately, so it shouldn't be used for that purpose either. Overall, understanding why these methods are incorrect helps us focus on the most accurate and safe techniques for temperature measurement.